guys, what's good? It's your boy Gurns from Mango Masala, Pi Radio's South Asian show. We're doing something a bit different today. We're doing our first kind of insight into different career fields. We're going to start off with physiotherapy. I'm joined by three, I'm going to call you experts in the field because I am certainly no expert in this. I've got Sabrina, who's a physio working in London. I've got Arnie, who's also a physio working in London. And I've also got Indeveer, who is from Vancouver and studied physiotherapy in Brighton and is in her second year of her master's. So I'm going to hand things over to you guys now. And yeah, I'm just going to take a bit of a backseat. So go for it.
So yes, I'm Arnie Putnis. My real name, my full name is Arnie, but everyone just calls me Arnie. So I'm a physio. I've been practicing for about 15 years. I specialise in frailty and complexity with older adults, and recently took a secondment opportunity at Health Education England, which is a strategic kind of body that helps to kind of look into education for the NHS as a whole. And I work within AHP, so Allied Health Professionals. So I've kind of moved from my clinical role into a bit more strategic post more recently.
India, was there anything else that you wanted to add?
I'm just a student from Vancouver studying at the University of Brighton. COVID kind of threw a wrench in my plans of spending more time in England, but nonetheless, I think I do have enough experience within the NHS to give my take on it.
I'm going to start off with just a topic going off the back of kind of what you said, Arnie. So how you said like what your full name is and how you prefer to go by Arnie. I'm the same. So my first name is actually Chandni, which is a very Gujarati name if you know it. But my middle name's Sabrina, and I tend to go by Sabrina. And I think the reason why I did that was when I was a student like India, I found that with a lot of patients, I was spending the first 5 minutes of my session kind of explaining my name, or it just led for them to ask me where I was from and things like that. So I think it's interesting just to show a bit of light onto how sometimes brown, South Indian, or even any people of color who have a non-English sounding name will switch it up in the medical field.
Yeah, absolutely. And I think for me, it wasn't, I made a conscious decision that when I went to university, I was going to call myself Arnie, and people called me Arnie at school. It wasn't like I just made up this new name, but I just thought when I go to university, I've had so many years of people being unable to pronounce my name, especially when they see it written down. It's spelled Ananthi, and that's how English people would say it, but it's pronounced Anandi. But no one could say it. I had so many years of teachers and other children not being able to say it. I was just like, do you know what, I'm just going to go by Arnie because it's much easier. And then I thought it'll be easier to make friends. It's really sad just kind of saying it out loud. Like I thought it'll be easier for me to make friends. I'll be more accepted. I can just get on with things without having to be this person with a weird name. But now I kind of think, gosh, it's such a shame because it's a really lovely name. And now I kind of think, is it too late to kind of revert back to my original name? But we'll see.
I think I'm in the same boat as you, and I think like now people in the physio world and generally just know me as Sabrina. Can I revert back, or will I lose kind of all of what I've done with myself known as Sabrina?
Yeah.
But I think one of the first topics is kind of representation of physios, BAME physios in the physiotherapy world. I don't really like the term BAME, and I think this is a huge discussion at the moment as well, and I think it has been touched on before, because we're not minorities. If you look across the world, actually we're probably quite the opposite of that.
No majority.
Yeah, absolutely. And I think if I had like Arnie, for example, if I had heard that story about you kind of wanting to revert your name kind of back so many years into your career, I maybe would have thought twice before maybe going with Sabrina at uni, or maybe that's just the path that I needed to take. Indo, would you be able to give us a little bit, if we start from the beginning, about what kind of student life is like for a brown international student? Could you highlight a few things?
So in Vancouver, I come from a community where it's predominantly brown, the community that I was raised in. So coming to England, I thought it would be very similar. I was supposed to either go to Birmingham or Brighton, and I chose Brighton. And the physiotherapy campus in Brighton is actually in Eastbourne. and everybody around me was white. There was nobody that was brown. My class was very diverse, but if you look more into the nitty-gritty of it, my class was diverse because it was all the international students. People from England were all the white people. So it was just a little bit, I think I was taken aback by it. And then going to work in the NHS, I always got, where are you from? And then I would, because I am an international student at the end of the day in England, and I would say I'm from Canada, and then they would say, where are you really from? Where are you born? And then I'd say Canada, and they're like, no, where are you really from? And I'm like, if you're asking me where my parents are from, they're from India. So it was a little bit different because I never experienced that at home, and then experiencing that in England was just different. Yeah.
It's interesting because I feel like if you'd gone to Birmingham, you would have had a completely different experience in terms of there is a mass Asian population there. It's renowned for it. So it's interesting to think how things might have turned out if you had gone there.
In and around Eastbourne, there's no Gurdwara, and I find solace in going to like a Gurdwara, like a temple. And that's when I realized, I was like, wow, there's really nothing around here. You have to go northern to like areas where there's an Asian community in order to find even food that I wanted to get, but very different.
I went to university in Eastbourne as well. I went to Brighton Uni, just probably a few years before you, and I had a very similar experience. And off of what you said, with regards to actually going to Birmingham, yes, you may have felt more ease than at home in terms of a larger brown community outside of uni, and maybe even within the university life. But on the physiotherapy course, there is a huge lack of diversity, and I think that's why there's a lot of work being done at the moment to try and really bring out new applicants to apply for physiotherapy, and to really boost up the amount of people of colour within physiotherapy.
Sorry, is that mainly the work that you've been involved with then?
I think there's a push from a lot of different places, personally speaking, from what I'm doing. So there is a organization that's come together called the Cultural Health Club, which is an organization of physios all over the country, all people of color. And we're kind of got a schools team running, which is kind of going into schools, speaking to GCSE and A-level students to actually promote physiotherapy, because I don't think a lot of people know the ins and outs of what physiotherapy is. People don't realize that actually it's not just, I've got shoulder or back pain, what can I do about this? You're on intensive care wards. You're seeing patients straight after they've had their stroke. Within 24 hours of their admission, you're one of the first faces they see. You're doing your full assessments. It's not just the doctors doing the assessments, and it's a whole kind of MDT is what we call it, a multidisciplinary team working together with other allied health professionals, pharmacy, which actually have a great representation of people of colour. You've got occupational therapists as well, and let alone respiratory and neuro, as Arnie said, what she's a specialist in within like falls and senior health as well. I think, Arnie, if you could shine a bit of light on kind of the stuff that you do within senior health.
Yeah, absolutely. So I did work in the community. So I worked going to people's homes, so people that weren't able to access hospitals or clinics. So mainly kind of older people who are vulnerable, who'd maybe had a fall, needed rehab in some sort of way. So really rewarding, and I really enjoyed that work in terms of going to someone's house. It's such a privilege to be allowed into someone else's space, and it also puts you in a very different position because you're going into their home rather than them being in your place of work. So you really get to know your patients. You get to work on really meaningful things to them, like being able to walk to the shop to buy a newspaper, or being able to walk to their bathroom by themselves. Like, these are things that make such a big difference to people's lives. So that's the kind of area that I love and I really enjoy, because I think I'm naturally quite a nosy sort of person as well. So I like kind of getting to know people, looking and going to their homes, looking, people like talking to you about their photos, their grandchildren, all sorts of things. So yeah, that's the kind of area that I like working in. Yeah.
Carla says you're the representation of like the general public within this. Like, did you know like physio kind of does more than just kind of like football physios or like rugby physios or shoulder and back pain physios?
This is gonna sound weird, but I think I was aware of both sides of it, but I didn't necessarily think that physiotherapy covered both of those, if that makes sense. I think I was aware that both of these different things existed, and also that I knew that obviously it wasn't necessarily doctors that were doing all of this, but I wasn't really aware that, right, you can study physiotherapy and then you can go down this route or this route. I wasn't aware that there's actually so many different avenues that you can go down. So yeah, it's interesting to hear.
Yeah, you've got pediatrics as well, so it's not just you're seeing adults, you're seeing children. You could see, you know, such a broad range of ages and different complexities of kind of conditions that you see. So it's so varied. And I'd say, you know, no 2 days are the same in the world of physio, because no two people are the same. So you're going to see different patients and have different experiences. I think that's the other thing I really enjoy about it, is that diversity. So you really get to see people, and you know, in the local area that you're working, you get to just know people really well, and see different walks of life, which I really enjoy, and being part of that process.
I think that's it for me as well. I think working on the wards, you see a variety of people from all different walks of life. You see the very rich, you see the very poor, you see the in between, you see the black, you see the white, and you see the brown. And I think for me, the biggest thing from kind of one of my experiences when I was kind of working on a stroke unit, I saw loads of stroke affects a large South Asian population, and it also affects a large Afro-Caribbean population. So it was nice for me to be able to actually give back to my own people as well in some ways. And I think the biggest thing for me when I was working on those wards is I saw the cultural differences. And after a stroke, you can have cognitive impairments, you can have speech impairments, you can have physical impairments as well. And I think the biggest thing with that is, if one of those things is slightly off and you're not aware of someone's culture, you may think that they might be cognitively impaired or they might not be speaking correctly, when actually they are speaking correctly, but they're from a Jamaican background and they speak patois, so they actually speak in a different grammar, or you know, they're from an Asian background, and you know, their first language isn't actually English, and you're asking them all of these cognitive questions about, you know, who's the monarchy. They may not know that. If you ask them maybe something about Indian history, because they that's where they were from, then you know, they might answer better and they might score better. Or if you were to ask them in their first language, then you know, you might get a different answer. And I think that's why I think I've got a massive push for representation within physiotherapy, because by me being on that stroke unit, I was able to educate the physios around me as well about these cultural differences. Although it's not my job to educate them about these cultural differences, sometimes you just have to take on that role for the sake of the patients.
I was interested, do you think, in terms of, you're saying you're educating people, do you think this ignorance is willful, or do you think if after you educate people, are people actually taking this into account, or do you think that it's just a case of people aren't thinking, oh, there's actually a difference? Like, I suppose what I'm saying is, do you think that there's a want to actually learn and educate themselves, or do you think even after you are pointing out there are obvious cultural differences here and you need to take that into account, people are still remaining ignorant?
I think it very is dependent on the person. Like, no one person is the same. So some people are all for listening and, you know, wow, you know what, I didn't realize that, you know, within this culture there's this kind of there's this factor, whereas some people kind of get slightly defensive sometimes. And I think in the words that you choose to use, I get very anxious sometimes before I sit down to speak to someone, because I'm already expecting that backlash and that defensive mechanism. Unfortunately, I've had it with very senior members of staff as well, which is really upsetting to see sometimes, because you think you're the leaders, you're the ones who are creating the atmosphere, you're the ones who are making the mood of the room. So if you're getting defensive about these things, then how are we going to move forward? And I think that's the biggest push, that we need to have more people of colour getting into physiotherapy and kind of working their way up into those more senior roles, and not even just people of colour, but just having those allies within healthcare as well. I think it's nice that we've got a room of kind of Inde, who you're soon to be graduating. I'm kind of a few years qualified, and you've got Arnie, who's in a very senior position within physiotherapy. So you can see that it is possible to move up the ranks from being a student to being qualified, to moving into a very senior position, and to be in a role with Health Education England, which is a very large thing as well, that Arnie's doing.
Yeah, I think like you were saying, Sabrina, like some people that you talk to, they just like you were saying, Carlos, they just haven't even thought of it because they've never had to think of it, and it's not through any sort of malice. They just haven't had to think about it before, whereas we're always thinking about it because we're people of colour. And so when you try and explain things, they can be really open to it. But then there are some other people who won't necessarily be like that. But I'd say generally, when it's to do with patients, people are very kind because it's focused on what's best for the patient. And actually, if you understand that patient better, then they're going to take that on board. I think when it comes to talking about relationships between staff, that's when it can get a bit more tricky. Because with a patient, it doesn't feel like it's so close. Whereas when it's a fellow staff member, it can feel a bit too close to the bone when you say something about how they've maybe, you know, that they've kind of displayed some sort of microaggression maybe, then they're going to take it as more defensive. Whereas if they've done something to a patient, it's, I don't know how, but it seems a bit more distant.
So speaking on that, being a student, I work under educators. So being a student, I feel like you don't really have a voice as much as you would as if you were in a working environment. And I've come across cases where one of the placements that I was in an NHS setting, it was a South Asian woman, and she was there, and my educator had said, oh, she doesn't listen to exercises, she doesn't understand what we're saying. And it was very upfront. I haven't even met this woman yet, and that's what she's saying to me. We go and see her, and she speaks Malayalam. I speak Punjabi. There's no language thing there, but at the same time, there's like a connection. And she spoke English. It was just with a bit of an accent, I would say. And the person that I was shadowing at that time, they didn't consider that, and they didn't even take the time to explain what was happening. And then when I came into the mix, I started explaining to the patient what was happening, why we're doing what we're doing. And just like that, they participated in their rehab program. And then thereafter, she's like, oh, because you guys spoke in your same language. I'm like, actually, we speak two very different languages, but we found a common ground. And if you took the time to explain it, maybe it would have been better. I didn't obviously say that to her because I didn't want to step on any toes, but very different.
Yeah, but I think that's why it's so important that we have people from diverse backgrounds coming into the profession, because we need a workforce that is reflective of our population, so that actually we get better health outcomes for our patients, but also we then create better health outcomes for ourselves. So people that are in employment, especially if you work in a career like physiotherapy, where you're guaranteed pretty much a job, you're in a secure job within the NHS, you know, you've got a steady income, it means your health outcomes are going to be better in general because you're employed. Yeah, and then you're going to have better health and your family will have better health, but then also you're impacting your local community. And the money that you earn is then being spent in your local community as well. So it's so important to have it's not just a nicety to have representation. It's actually like a public health issue.
I think off of the back of kind of what you both said, I just wanted to share a couple of stories that I thought would just resonate quite well. So I think from the first bit of what we were speaking about, as in some people are just absolutely unaware that racism kind of exists as such, or even like there is different cultural backgrounds of things. When I was at my old trust, I kind of when the Black Lives Matter kind of stuff came up, and there was protests happening and things like that, someone actually sat down and said, Sabrina, does racism still exist in the UK, in London? And I said, honestly, if you don't know that, then like you really need to get out there and be around more people of color, because I'm telling you, every single person of color in London has experienced something, whether it's I'm walking across the road and, you know, someone's not indicated and I'm still crossing, and someone's then shouted out at me, like hooted their horn and said, go back to your country or whatever it is, you just get that. And it's just a part of being brown or being a person of colour in London. Another story that I wanted to say is that recently, so I've started working in Southwest London, and there is a large South Asian community, and a lot of our patients actually speak Gujarati, whether they're Muslim, whether they're Hindu, whatever it is, they speak Gujarati. And luckily for me, I speak Gujarati fluently, and that actually comes into aid when I'm doing some of my sessions. So sometimes there'll be this patient who they've just not been able to get up, as India said, because, you know, no one's sat there and spent the time to get a translator, because there's translators available in the NHS, but it's just sometimes difficult to organize, so people don't want to go that extra mile to kind of organize those things. So I was on the ward and I just finished doing a session with someone, and the person next door was kind of like, oh, were you just speaking Gujarati? And I was like, yeah, I was speaking Gujarati. And they were like, that's crazy, I've been coming to St. George's Hospital for the past however many years, and never have I had a clinician actually do a session or speak to a patient in Gujarati. And I think sometimes it's difficult with the medical lingo to transfer some of that language across in Gujarati or any other kind of language. But I think just trying and persevering a little bit, it just gives that patient a little bit more morale to kind of comply with what needs to be done. And I think that kind of moves on to kind of a topic that was sent to us about kind of what might be discussed in the medical profession. Does one size fit all? And is that kind of something that has been going on in the medical world?
So what do you mean, sorry, about does one size fit all? Does one size fit all?
So when I say like, does one size fit all, is in when we're doing our training, are we taught about different cultures and how different people may react to things, whether it's a rash might look different on a brown person compared to on a white person, you know, is pregnancy the same for all populations, things like that.
Yeah, I mean, I trained a long time ago, 20 years ago-ish. Oh God, I'm so old. But we didn't learn anything like that. Nothing at all. Wasn't even touched upon. It wasn't even a topic. And I remember being on placement, and actually I wasn't even on placement. I think I was working in the NHS at that point, and learning about Asian pain. So I had someone tell me that Asian women will just complain about pain, and they have this thing called Asian pain, and they're not really in pain, they just make a big fuss. So, you know, loads of Asian women have chronic pain, it's because they're just making a fuss. And I was just like, oh, right, like, is that true? Like, that can't be true. Like, you know, and as a sort of junior member of staff, that you're being told by your senior that that's what it's like. And you're like, okay, well, I'm just learning. So, okay, yeah, that must be right. And now I look back and I think, it's complete rubbish. Like, that's not true. Like, you know, it's just the stuff you get fed, but if no one's there to challenge it because you don't know to challenge it, then you just accept that as the truth.
I heard that
now education, I hope now education is different.
I heard the exact same thing as you did at the same placement. Actually, it was something about how Asian women tend to catastrophize their pain. And I was like, what? And I didn't catch it. And I'm like, I didn't know that was a thing. But to challenge it, I said, no, you can't really challenge. You can't say somebody's not in pain. It's very hard to, how do you prove that they're not in pain?
And I think pain's one of those things which is so subjective that you can't actually put anyone into a category like that. There is some work being done by the pain community, and they're kind of led and based from Brunel University, and they're doing massive amounts of research into Asian women, Asian people, and just like people of color in general, and the barriers to accessing healthcare, to receiving the correct healthcare. And I think if you look at the researchers who are doing this research, they're all South Asian people. And that is another reason why we really need to have more ethos of kind of having more representation of South Asian people in physiotherapy. I've said that about 15 times. I'm probably going to say it about another 20 times, so bear with me.
I don't know about you guys, but like when I was like my parents are both in the medical field. Like my dad's a doctor, my mum's a nurse. They're both retired now, but they never spoke to me about physiotherapy. They were very much about medicine. You know, you should be doing medicine. Why aren't you doing medicine? You should get the, you know, you've got the grades, you should be doing medicine. And I kind of feel like a lot of people within my community were kind of expected to do medicine because that's like the job that's got the most prestige. And actually, if you look at the kind of the data, there are lots of Asian doctors, you know, heaps of them. But in terms of physiotherapy, there isn't. And so I kind of, and what that was one of the questions that someone asked me to discuss on the thing was about, you know, what did your parents think about you choosing to do physiotherapy? And in my mind, they kind of let me do it because I would be a health professional. I would work in the NHS. So, yep, you've got a good job. You're going to university, so you're getting a degree. You don't want to be a doctor. Okay, that's fine. You don't have to be a doctor, but at least you're working in health. And I don't know whether you guys had similar experiences of your sort of parental expectations.
My mum's a hairdresser. She went to university and did a maths degree because her dad said, you know, go to university. So she did that, and then as soon as she finished, she did the hairdressing course and became a hairdresser. So there's never been a massive push on me kind of for what I have to do, which is really lovely actually. But there is always somehow a comment. I had to do work experience at a dentist when I was in year 10 and year 11 because my mum was like, oh, you should become a dentist. And then I had the grades for medicine and I chose I didn't want to do medicine, but it's like, why don't you push yourself and do medicine? And even now, when I have to explain to my nan about what I do, my daddy, for those who speak other languages, but when I have to explain to her kind of about my profession, I go, yeah, I'm basically a doctor. And that's the way I have to explain it, because in their mind it's like either you're a doctor or you're a nurse, and that's as far as their exploration into the multidisciplinary team goes. But I think I'm passionate and I want to explain kind of that, you know, I'm a physiotherapist, but there's just, I don't have the language to be able to explain my whole role to her.
So my family has always supported education. It doesn't matter what you decided to do as long as you go ahead and get an education, especially as a female in my family. I don't think the pressure was put on my brother as much as it was for my sister and I. My mom was in the healthcare field. She was in nursing. She never said, do this. Obviously, she did mention, like, why don't you go for medicine? Why don't you go for medicine? And I said, contrary to popular belief, not everybody wants to be a doctor.
Yeah.
Which she was fine with. She knows physiotherapy. My dad had injured his leg when I was like 16 years old, and I was with him during physiotherapy appointments, and they knew I was always into doing rehab and I wanted to do rehab. So I think for me, familial wise, I was okay as long as I went and got educated. But explaining it to other family members, especially elderly family members that may not be familiar with physiotherapy, I kind of follow the same suit as Sabrina, where I was like, I'm like a doctor. I don't know how else to explain it to you. Because there's no, either you're a doctor or you're a nurse. Exactly. Like there's no in between, and then they don't understand anything in between, which is why I try to raise more awareness for it. And I try to talk about it more and say more of what we do, because we are different. Like we are more about being in community rehabilitation.
I got asked in one of my physiotherapy interviews when I was applying to do physiotherapy, why aren't you applying to do medicine? And I was like, because I don't want to be a doctor. I was like, what a stupid question. I was like,
yeah,
what are you asking?
I'm at a physio interview. Like,
yeah, I'm like, hang on, have I come to the right place?
I think off of the back of that as well, I think it's a bit about the kind of the culture. So I think like for my granddad and for my dad, they would rather pop Smarties than actually get up and exercise as such. Like I think so if I go back, so yes, I have like that Indian heritage, but my family migrated across to Kenya, and they've been in Kenya for many years, and a lot of they're quite the Asian population in Kenya are quite wealthy, and what they do is they work, the men especially, they work, they eat and they drink, and that's kind of it. And as long as they're kind of bringing money in, it's okay. And that's kind of just the culture behind it. And I think a lot of kind of what I grew up on is kind of more herbal medicines and things like that, because my mum's kind of not for popping a pill. She would rather get active and exercise rather than having to take like pain medication or whatever it is. But on the other hand, I've got my dad who's the polar opposite, and even after I finished my physiotherapy degree, although I'd gone and got an education, he had the audacity to say, I don't actually believe in physiotherapy. And it's like he will not listen to anyone but a doctor, which is sometimes a bit upsetting. But I think I've got to that point where I'm like, I know what I do, and I make such an impact on so many different people's lives that your one opinion, that's your loss if you're not participating in physiotherapy, because you're now not going to get rid of some of your ailments.
I think especially for the South Asian population, especially when like things like cardiovascular disease and anything along those lines are so prevalent, understanding exercise and getting moving and physiotherapy is so important. So I do think it's really important that we endorse it as much as possible and educate across the board for something like that. And going off of that, if it makes you feel better, I think parents in general don't like listening to their kids.
No, my parents me.
Exactly. So it's kind of like,
is that a South Asian thing or is that a general thing? Carlos, what do you think?
So I've got like both sides. So I've got like the South Asian side and the British side as well. So I think it's an especially South Asian thing, but I also think it is common amongst all parents. I think there's this lack of desire to maybe, because I think also it comes back to this whole thing of like, is it will for ignorance or is it just ignorance sort of thing? And I think with some parents you can try and explain stuff to them, and even when you've done that, there's still that kind of barrier. They just don't want to engage with it, and there's only so much you can do. But with regards to your question about South Asia, I definitely have a lot more trouble trying to convince my dad of certain things than my mum. So yeah, I definitely think it's quite prevalent in that sense. Yeah.
I think with my parents, it's partly because they still think of me as being a child. Like they don't realize that I'm an adult, even though, you know, they've got grandchildren now. They still think of me as being, and I'm the youngest, they still think of me as being the baby. But then also I think because I'm not a doctor, then what would I know? Because, you know, I don't have any experience in this world, and, you know, I don't know what I'm doing. But then, yeah, it's interesting. Whereas my mother-in-law, who is white, so my husband's white, so my mother-in-law's white, you know, what did she do? She pulled her Achilles tendon. So I gave her some exercises to do, and she did them. And then a couple of weeks later, she phoned me up and she was like, Arnie, she was like, physio really works, doesn't it? And I was like, what? She's like, I didn't really think it worked, but it really works. She's like, listen to you. I did what you told me to do. She's like, it's so much better. She's like, it's amazing. I'm going to tell all my friends. And I was like, okay, so it's maybe it's a generational thing as well, not thinking that physio or exercise or movement. Like I suppose, you know, for our sort of generation, we've been brought up thinking that that's what you should do. And exercise is really good and it's really healthy. And I suppose we've all gone into physiotherapy, which is about movement. So we all kind of buy into that idea. But for the kind of older generation, that's less the case, I suppose.
I think it's the same sort of thing you see with mental health as well. There's definitely, I think especially in South Asian and or general BAME communities, there's kind of this aversion to talking about mental health, which is also linked into this idea of there not being the lingo behind it. It's just there's no translation for it. But then at the same time, it is also a generational thing. Like you'll find that regardless of what culture people are from, if you go back, say, 20, 30, 40 years, like people just don't they just don't think it's a thing. And I think on the British side, you have obviously there's this kind of like, oh, stiff upper lip type of thing, like, oh, we went through the war, even though it's like literally we were born 20 years after it, you didn't go through the war, like literally, like but yeah, you'll find it across all cultures, I think.
I think it's interesting how you speak about like a cultural thing. I think a lot of the time, what I see within healthcare as well is if you do have a patient who, you know, like say you have South Asian female, and she's presenting with this thing, and it's massive, like catastrophizing about her pain. I say in inverted commas. People will label that as a cultural thing, but then leave it as that and not explore it any further and not think that you can change that at all. And I think what Arnie said at the beginning, kind of about how if you are someone who is a person of color who comes into physiotherapy, you're providing yourself a stable job, you're then providing yourself a stable income, you're creating that career, you're able to house yourself, then you're furthermore impacting the community. And I think this cultural thing, we can, and I strongly believe that we can have an impact on it. You're not going to be able to change everyone, unfortunately. People will only change when they want to change. But for example, for me, alongside NHS work, I also do some private work. So I was qualified as a masseuse before I even qualified physiotherapy wise. So I offer physiotherapy or massage, and I find that a lot of the South Asian population of people that I have coming to me will opt for the massage option if they realize that that's available. So sometimes I kind of don't tell them the massage options available until a few sessions in, when they kind of like find out for themselves. But the ones that you see start doing physiotherapy and they see the changes, they're like, wow, this really works. The same response that you got from your mother-in-law, Arnie. And then they go and tell their friends, and their friends tend to be similar to them, whether it's a middle-aged brown man or a young black girl or old, mixed race person. And through that, you will then implement that change and remove that cultural thing as a stigma.
It is interesting seeing who people actually listen to. Like we were talking before about maybe they won't listen to their actual kids, but if it happens to their friend, or if it happens to a celebrity they admire, or even like, God forbid, it happens to them, like it might take that for them to actually be like, okay, maybe I was wrong, like sort of thing.
Going up from what Arnie said before, I think after somebody goes through physiotherapy is when they start to believe in it more. Like your mother-in-law, the amount of times I've heard, I can't believe physiotherapy actually works. Like, yes, it works.
One of the hardest parts that I find about that is obviously I don't care about the money. I like, if you go into physiotherapy, you know that you're not in it for the money, because there is no money in physiotherapy. But I sometimes feel like
Canada.
But in the UK, like, I feel like I want to give you a free physio session to just unlock your mind into actually, you know what, physio could work for you. But then it's also having those boundaries within yourself, like not exploiting yourself for kind of like, you also need to make ends meet as well. So I think like if you're in a position to offer those like free sessions or whatever it is, then that's great. But and I think that's why the push is to kind of get into physiotherapy like young if you can, and then hopefully by the time you kind of build yourself and you're in a more of a like senior position where you are more stable, you may be able to make more of those changes further along down the line of your career.
I was just thinking when you were talking there about like some of the patients that I've seen, and I used to be given the most complex patients. Like, if they're really complex, give them to Arnie. And all the patients that I would get would be from minority ethnic backgrounds. And it was really interesting because I didn't really notice to begin with that was the case. And then I sort of realized, and I was like, oh, that's interesting. Now, why are these complex patients being labeled as complex? And when I looked at it, and then when I looked at kind of people that would come to me with their patients that were complex, they're the kind of patients that had kind of fallen through the net, that had gone from service to service, that they'd never quite responded how the therapist thought they should respond, or they'd made a complaint, or something had happened that had made them difficult, which was really interesting, because then when I saw them, often what I was doing wasn't actually what I would say proper physio. I was just having a conversation with them and just being myself, and just being like open and honest, and just finding out what's happened, what's your journey, what's your story. And then you start doing the physical stuff. But actually, a lot of the therapists along their journey hadn't been able to take that step back and offer them that space to do it. And whether that's to do with ethnicity or not, I suppose I don't really know, but I kind of feel like the patients that I've treated that are people of colour, I kind of feel like there's that connection, even if it's a different language, it's just the colour of your skin. They know that you've been through a similar, or you may have been through a similar experience to them, so you might understand them a bit more, which I find really interesting, because then you're seeing the people that need you the most, which is, you know, really powerful.
I think touching off of a couple of points that you said there, Arnie, and I think it's very interesting that you had that experience, because I find often I've had a similar experience as well, that even though I'm kind of, even as a junior physio, it was like, oh, give that patient to Sabrina, maybe she'll be able to deal with them better. And it's like, but you're my senior. Should you not have been able to do better than me? A question for you, Arnie, how early in your career did this kind of stuff start happening, where you were given the more complex patients?
I don't know. I suppose in my last clinical role, that was my role, was to see complex patients, so I then got all of them. But before then, I suppose I think it comes back to that bit about me being nosy. So I'd probably take more time to get to know people, to try and get, like, so I'd be a much more holistic therapist. Like if someone would come in with elbow pain, I probably wouldn't talk to them about their elbow, like initially. I'd probably talk to them about something completely different to try and get to know them. So I think my way of working probably, I don't know whether I attract complexity or whether I don't think people specifically gave me their patients that were complex until recently. Yeah. But then it's a different way of working, and whether I am the way I am because of the experiences that I've had, and so I've had to be more resilient maybe.
And do you find that you kind of tap into more of, like, when you're having a bit of a nose about and like kind of just building that rapport as such, do you feel like you overcome like maybe some of the psychological barriers that someone who hasn't taken that time would not have stumbled across? And how much of what we do you think is actually based upon psychology? Like if you've, for people out there who want to get into physiotherapy, is a lot of what we do psychology based?
I think it is, because it's based on building rapport, it's based on building trust. And actually, I suppose I have a real firm belief in that other people know what's right for them and what's right for their body. So I rarely tell people what they should do. It's always about a discussion to come to some sort of like joint decision about something, because actually nobody wants to be in pain, nobody wants to be ill, people want to get better. But if you tell someone to do something, they're not going to do it. Like if someone tells me to do something, I'm not going to do it. So it's about kind of building that trust, building that rapport, building relationship. So yeah, a lot of psychology, a lot of going a bit deeper than just the elbow.
Yeah, absolutely. And I think where you were talking about kind of some of those difficult patients, I have a story to share as well. So when I was working on one of the elective ortho wards, which is kind of when you have your hip and knee replacements, and then you come to this lovely ward normally. It's normally quite well staffed and well stocked. And I had this lady who was of Nigerian heritage. And she in the morning would have her prayers on, like she'd be listening to, you know, her hymns, and she'll be attending kind of like her church services and things like that virtually through her phone while she was in hospital. And it'd be playing quite loudly, because if you ever go into like an ethnic church, like it is quite lively and things like that. So what this ward did said, oh, she's being really loud and being really difficult, and put her right at the end of the ward, kind of away from everyone, really isolated her. And when I saw that, I was like, kind of what is going on? Like, has anyone complained about the noise? But it was more the staff members that had a problem with the noise as compared to the patients. And I thought, are we not here for the patients as compared to what our preferences about our working environment are? Because we have to be flexible, because that's part of our job. When you're working on A&E, you've got all kinds of funny noises going off in the background. When you're working on ITU, you've got so many machines going off at once. So I think that's another reason why we need more people of color, not only in physiotherapy but also into the healthcare sector, because it's the nurse's decision, kind of the senior nurse's decision to allocate where that patient's bed's going to be. but I do appreciate that there is a bit of a glass ceiling sometimes for people of color to get into those senior positions. And I'm not going to sit here and tell you dreams that it is easy to get into those senior positions, but it is possible.
Yeah, I think, you know, my current role, I've kind of been looking at how people choosing to become a physio and becoming an allied health professional, but you can't really look at that in isolation, and you look at that kind of career progression and you see there is that glass ceiling at sort of about band 6, band 7 level, and there's a massive drop at band 8A. So, you know, you kind of look at, and in my position at Health Education England, I look around and I'm like, where's everyone else? Like, where are all the other people who are brown and black within this area? And it's really strange, because then you're like, okay, well, I'm doing this work trying to improve the ethnic diversity, but there's not any ethnic diversity around me. So it's trying to work out how do we create a system that allows people to flourish and thrive and grow, to allow people to move up through those bandings.
Seeing you in like a higher up position, being of South Asian descent, is inspiring. My course leader as well, he is also of South Asian descent, which is also inspiring as well. I feel like I haven't seen that anywhere else. I personally haven't worked with anybody that was BAME or anything in higher roles, so it's really nice to see.
Oh, well, that's good. That's good. I think I've been working for maybe about 10 or 12 years, until I went to this lecture about osteoporosis, and there was this Asian woman from Canada actually, and I remember listening to her speak, and I was like, wow, I've never seen anyone that looks like me doing my job. And I've worked in London for 15 years. Yeah. So I was like, wow, this is amazing. Like, this is so good. And I hadn't even realized that I hadn't had it until I saw it. And then I was like, okay. I was like, so someone that looks like me can do that. That means I can do that. And yeah, there is a real power in sort of having people who you can kind of, and I don't want to use the word look up to, but kind of, you know, people in higher positions that you can think, well, if they can do it, I can do it. And honestly, if I can do it, anyone can do it.
I think it's having those role models as such as well. I think, like, I had a very similar experience last year. I was listening to Geeta speak, who's also a consultant neuro physio based in London as well. And she was speaking on this webinar, and she was talking about how, like, code switching and how we code switch. So physio is a very white middle class profession. So you end up speaking like very white and middle class. You put on your telephone voice. When she kind of was like, actually, I got to a point where I was like, I don't want to code switch. This is who I am. I have the clinical knowledge. If you ask me something clinically, I will give you an elaborate answer and it will be correct. So just because of the way I speak, that shouldn't make me any lesser than anyone else. And I think listening to her speak and her being like so like reachable in terms of like being in London, being in that consultant physio role, you're like, actually, you know what, maybe I could be something like that. And since I heard her speak over the past kind of year in the office, I've used mandem like here and there. I've used the odd slang word here and there, and I've not felt anything about it. I've not felt apologetic about it. People might have looked at me funny, but when they look at me funny before, I would be like, oh, I've said something wrong, let me apologize for that. But now I'm kind of like, if it's your problem, it's you that's got the stink face on, it's not me who's got the stink face on, it's not affecting me. So yeah. I'm going to carry on being me, because I know I make a difference to my patients, and I'm still holding up all my responsibilities for this role the same way you are.
Yeah, I think that thing about role models is so important. And there's the Chartered Society of Physiotherapy, which most physios are kind of members of, and within that there's a BAME network, and there's a WhatsApp group, and there's kind of an online forum as well. And that group is just so powerful to be able to kind of, and when you're a student, if you're a CSP member, you can become part of that group, and it's just full of these amazing role models who are like professors and like experts in the field, and you know, they've written books and they're presenting internationally, and you're like, wow, I just have access to all these people to be able to say, you know, oh look, I've got this interview coming up, anyone got any advice for me? And they'll be like, you know, Sabrina, you'll know, like 10-20 responses, someone will offer to like give you interview prep. Like, it's just such a supportive environment to be part of. Definitely helped me in my career.
and it's a great way to be able to network as well. I think Arnie, that's why I first saw your name pop up, to be fair, within that group chat, and I was like, oh, who's this person?
What's she up to?
Yeah. And I think the last topic that I just wanted to touch on, because obviously it's very hot kind of at the moment, is kind of about vaccine and people of color, and kind of the barriers, the facilitators around it. I think a lot of BAME people have kind of spoken out, and there's loads of posters you see of BAME people, like the NHS promoting, saying, I've had my vaccine, you know, as a bit of reassurance that other people should get their vaccine. I know, Arnie, you're doing a large amount of kind of work within this, so I might just hand over to you to carry on.
Yeah, so I did some listening events with AHP, so allied health professionals from BAME backgrounds, in kind of January, February time, and lots of people spoke about the vaccine and should we have it, should we not have it, and it was really interesting to listen to, because all the stuff that people were saying kind of, you know, resonated with me, and they're like, well, I don't trust the system. Why should I have the vaccine? It's produced by white people who don't know me, who aren't thinking about me when they've produced it. You know, we know that the vaccine, we know that COVID affects us differently, but we've been affected more adversely. So how do you know the vaccine isn't going to affect us differently? People spoke about, you know, the medical experiments that we've done to Black people. And, you know, when they spoke about that, I thought, gosh, well, that was a long time ago. And then I looked it up and I was like, no, it was in the 90s. Like, that's really recent that stuff was happening. So I was like, this kind of mistrust in the system is so huge. It's way bigger than the vaccine. And actually, when I asked people, like, what do you want? They were like, we just want to have the facts and we want to have a proper conversation. And I suppose it kind of comes back to what I was saying about having a belief in people and people's ability to make their own decisions. And actually, if you tell someone to have the vaccine, they're not going to have the vaccine. Like, it's a thought process that needs to happen, and you need to weigh up the pros and the cons. You need to weigh up the risks and the benefits of it. And so that's kind of part of the work that I've been doing, is trying to encourage within the NHS managers who have been told any staff member that hasn't had the vaccine needs to have a meeting with their manager. And I was like, that meeting is make or break, because actually you could do so much damage in that meeting by not understanding that other person's perspectives, or you've got a real opportunity to build that relationship and get to know that person, and then help them to make a decision, but not the decision you think they should make, but just their own decision. I know, Sabrina, we kind of chatted about it, didn't we, about just making an informed choice. And that's what, as health professionals, that's what we're always told in terms of patient care. Like, it's about people making their own decisions. And I really believe the vaccine is the same thing. And it's about weighing up, okay, what's the risk of having the vaccine versus the risk of not having the vaccine? For me as an individual, for my family, for my children, for my parents, for whatever it is, and then what's the risk of me having it, and how does that weigh up? And I don't think any of us should be judging people's decisions on it, because it's an individual choice. But you know, recently in the papers it was saying that the BAME population, their uptake has gone up. So something's, you know, the government's marketing strategy, and whatever's happening is working. So yeah, that's what I've been up to with the vaccine.
Carlos, what are your thoughts on the vaccine?
Personally, I'm obviously all for it. Well, I say obviously, that's what I mean. Like, it is literally like, I don't know, like it's hard. I think it's hard, like, to not get frustrated, like when people maybe aren't like aren't engaging with it as much. But I suppose that's because I come, like, my parents are both from medical backgrounds, so from that perspective, there's never been any sort of like doubt in anyone's mind about getting it. But yeah, no, I can definitely understand why people are mistrusting of British medicine in general, and we see it every day, isn't it? And it's like literally the other week, institutional racism doesn't exist apparently. So
I was literally going to come off of that point, like literally that once the race report was released, I was thinking that's an academic piece of work and it's managed to slip through such rubbish. Like, has come through from it. And me as a healthcare professional, I've worked with COVID patients, I've worked on the COVID ITUs. I would live at home with my parents, so I personally was really like, I was really split with taking the vaccine. I was like, I don't want to put anyone that I love at jeopardy, but at the same time, I really just don't trust. And I feel like I can't say that I haven't taken a vaccine like to anyone, because I just feel like I'll be labeled as an anti-vaxxer, but that's not it at all. I just genuinely like just don't trust. I've got a lot of family who are in the health, like a lot of my cousins are like scientists or pharmacists or whatever, and they've all been very much pro vaccine, and at like family Zoom calls or whatever, they'll ask me, oh, have you had it? And I kind of just go a bit quiet, because I just don't want to be that person who hasn't had it. But now that kind of they're bringing in maybe the vaccination passports to be able to go abroad, I just feel like you're taking away a human right from people, because people don't have to have the flu virus every year. It's your people have to be able to make that their own decision on it, knowing the risk that if you were to get COVID, it could end really badly for you. But at the same time, like, it is your choice. And I think that's the biggest thing that you're pushing for as well, Arnie. Is kind of allowing everyone to make that informed decision. But I think our government's moving into very much a dictatorship with that, and we're kind of pushing towards like, you have to have it, otherwise you will not be able to be in the community. Basically, you won't be able to go to festivals, you won't be able to go on holiday, like you will not have a great quality of life.
I think we see that with everything really, there's this lack of desire to consider any sort of cultural context, and in this circumstance it's even outside of within the realms of focusing mainly on BAME people. If we're looking at anyone who's slightly skeptical about the vaccine, there's just a lack of desire to actually think, okay, why are people actually a bit skeptical about it? And but going back to the whole idea of focusing on people of color, we see it, for example, with the idea of like them not taking the time to understand there's a difference between forced and arranged marriage. Instead, they'll just come down really hard on what they think is forced marriage, when in reality it's actually arranged marriage, and all participants are more than willing to go ahead with it. But because they come down hard on it, that's actually what pushes people further away into their own private lives, and is what leads to these few quite negative occurrences that actually are forced marriage. And the whole, I'm not saying that it's the government that have caused this, but at the same time they definitely facilitated it. And if they took a different approach, and they know this is happening, but there's no desire, and that's why I'm not really surprised that there's not really any desire on their part to think about this in regards to the COVID vaccine.
I mean, with the vaccine, I think like there has been some specific work done. Once they realised that actually the vaccine is not the issue is the mistrust of the system, there have been lots of people that have come out that have said, okay, we need to address that, because that's the issue, which has been very good to be able to, there are loads of webinars that are out with like Kevin Fenton from like Public Health England and Yvonne Coghill, who's from the National Race Observatory, kind of saying like, look guys, we know this is really bad, we know there's mistrust in the system, let's talk about it, and let's then talk about the vaccine as well. But I think on a smaller level within trusts, like within hospitals, there isn't necessarily that level of understanding, because people haven't had to think about it. Like what I was saying before about that kind of cultural sensitivity, if people haven't had to think about it before, then they won't, whereas now you're kind of being forced into doing it. So it's trying to make sure that people have those conversations in a meaningful way that can build rather than destroy.
You know what's mad though is I'm thinking about what we were talking before about who people actually listen to, and sometimes they listen to my friends. And I've been thinking about how you guys have said like people just don't believe in physiotherapy. Yet when you were talking about mistrust around the vaccine, my head just went to WhatsApp and obviously the infamous forwardings and WhatsApp antis and all that, and I was like, literally these people are more than happy to believe this like chain mail that's been forwarded on their WhatsApp, which is, I know, like, I was literally, I won't name and shame them, but I was with a South Asian elder person, and they got this thing during lockdown, and it was about, oh yeah, the hospitals are this, the hospitals are that, and I was like, okay, so where have you read this? I was like, oh yeah, I got it on WhatsApp. I was like, no, like, yeah, I'm sure if you said to that same person about some kinds of physiotherapy, they'd be very skeptical and just like, why are you willing to acknowledge this WhatsApp, but you won't listen to a medical professional? And it is, again, I think it depends on who it's actually coming from. Like, it's just weird how those semantics work.
That's interesting. Does that mean we need to make a WhatsApp thing and have it forwarded around in order for everybody to believe in physiotherapy?
Reverse psychology.
It's a good idea. Maybe
We're on to something, guys.
It's interesting to see the vaccine rollout in England. So from a global perspective, England seems like it's thriving with the vaccine. I actually didn't know that there's some people that are doubting taking it, because Canada has done a horrible job with the rollout. But again, anybody that I know is, if there's a vaccine, you go and take it. But it's just not available to everybody yet. So I think maybe it being overly available makes people mistrusting, because usually if something is scarce or scarce, you're like, I really want to get my hands on it, whereas everybody has it and you're like, I don't know if I want it.
Obviously there's probably, or hopefully, going to be people that are watching this that are maybe in their late teens that are interested in going down this route of physiotherapy. So I just wanted to know, like, what advice you guys have for them about maybe these different associations that they can maybe get involved in, or any advice you have now looking back on your time about how they should go about applying, or anything down that route, basically.
So for me, I did my undergrad here in Vancouver at Simon Fraser University, and then I took a bit of a gap year. Even though I knew I wanted to do rehabilitation, I wasn't sure whether I wanted to do physiotherapy, if I wanted to do OT. And what made me decide to come to England was I had visited Europe the year before, and I wanted to move away from home in order to go to school. And I said, why not England and go across the pond, which worked out. Application wise, it was good. I don't remember my application, which is interesting because it was only 2 years ago. But anybody that is looking to go into physiotherapy, I would definitely say go and volunteer with another physiotherapist or in the community, just to get an idea of, is this what you actually want to do, so you understand it. Because a lot of people, I feel like, will be like, this is a good job, I'm going to go into it, and then don't have an idea about what it is. And I'm not discouraging anybody. I do want people to go into physiotherapy, but it's more that I want to make sure that everyone understands what they're getting into, what they know, that they know what the career actually entails, so they can work to promote it. Whereas somebody can get into it and they may not like it, and then have a negative light on it, which can affect other people around them that may want to go into physiotherapy, but seeing this person kind of deters them.
I think, yeah, off of the back of that, I think one of the biggest things while you are like applying for physio, or even doing your like work experience or whatever happens to you and whatever anyone says to you, don't take it personally. Because it's not intended sometimes at you, or sometimes someone's just having a bad day and it just comes across like that, and sometimes that can really get you down and deter you and really lower your confidence within the profession. But if you don't take things personally and you kind of just brush them off and carry on doing, then that's one of the biggest things that I'll highlight. For any student physios who are listening out there, I would say just remember why you're there. You're not there for the team, you're not there for anyone else, you're literally there for that patient. And I think that's the biggest thing that kind of keeps me going. Sometimes I like write a little reflection after a patient's kind of given me like, oh my God, I want to take you home to marry my son. I will remember that. And like, you know, it's just those small things where you've gained someone's trust, you've made someone better, and you know they've acknowledged that. I think for anyone who's applying, there is various different groups. I'm sure if you kind of approached even like the CSP BAME network on Twitter, you'd get a response. Cultural Health Club is another group. There's the pain community, which is kind of looking more into research, but that's something, if you're someone who is willing to give a bit of time and actually create research so that we can get rid of these stigmas in terms of, you know, South Asian women catastrophize their pain. If we're able to create literature to put down people's throats that actually know you're wrong in what you're saying, then that's something that I would also recommend. I think when you think about where you're applying, I think there's a massive pushing for more kind of diversity into each place, but do not, like, prepare yourself a little bit for that culture shock when you arrive, that you may be one of 4 people who have colour on your course, because that's what it was like for me. And I was a bit like you, Inda. I grew up in like West London, in a very brown part of West London. So I was not the minority by far, I was the majority. I then went to live in Kenya for 2 years, and again, I was not a minority. And then I went to Eastbourne, and people used to look at me when I was walking up the road because they just haven't seen a brown person. I was like, oh, okay, this is a bit odd. But don't let any, like, you will sometimes, there will always be ups and downs in your pathway, but be passionate, be patient, bear with it, and you know, you'll get to where you want to get to.
I would say definitely get work experience, which can be really difficult to do unless you know somebody who works in healthcare. So I would say definitely, if you're on Twitter, use the BAME CSP network, or just the Chartered Society of Physio, contact them to find out what opportunities they know about. There's also a great website called I See the Difference, which has got loads of information about different allied health professionals, including physio, and it then can direct you to like where there might be like online work experience, where you can kind of do virtual things, or you can be linked up and do it remotely. Because of COVID, you know, they've had to kind of think a lot more creatively around it. So there are opportunities out there. You just need to kind of have a little dig around to try and find them. And then I'd say, if you do decide you want to go into physiotherapy, it's worth then trying to find like a mentor of some type, of some sort. And again, the Chartered Society of Physio will help do that, or the BAME CSP network, so that you've got someone to talk to and someone to help guide you through the whole process. It's like a sort of a friendly aunt kind of taking you through things. But yeah, I'd say physiotherapy is a great career. I love being a physio. I love the work that I do. Like, yes, I'm a minority, but actually in the work that I do now, I see it as a real privilege to be able to be in that space and influence and change things. And actually, I get to speak to people in positions of power and explain things to them, which up until this point, you know, there hasn't been anybody in that sphere that's been able to do that, because no one's applied for those jobs, or no one's been successful in those jobs. So I kind of say, yeah, get work experience, make sure you want to do it, and then find a mentor, and then just go for it. It's a great career.
I think off the back of that as well, if you're happy to, Carlos, like whether it's on the description or whatever, like you can put my like at in there, and like I'm happy for people to contact me like personally and whatever. Like I'm quite responsive on like Instagram and Twitter, even if it's just for a bit of guidance, or if I can direct you to someone or somewhere, or even if you just want to ask a question. Sometimes you just have a question that you're dying to ask, but you don't feel like you can relate to someone or ask someone because they seem like they're high up in this profession. But like honestly, like just drop a message and I'll reply. It's the same way how we kind of organize this in some ways. It was just dropping a message to one another, and then boom, bow, this came about.
Thank you for organizing this, by the way.
Yeah, thank you.
Thanks, Carlos, for having us on. Like, really appreciate that.
No, like, honestly, like, thank you, Sabrina, for like reaching out. Like, I think this started out like, honestly, it was really nice, because I think you messaged us saying like, was listening to this episode whilst I was on my run, and I was like, wow, people actually listen to it. Like, that's really nice. But yeah, honestly, like, this has been really enjoyable, and hopefully we could maybe do something in the future again, see how this does, and also like in other career professions, like, yeah,